me just present here. So I'm the Director of Information Security at Catholic Health Initiatives, and Catholic Health Initiatives, or we call it CHI, is the third largest nonprofit health system. We have approximately 96 hospitals in 18 states and have about $13.9 billion in annual revenue. We have approximately 120,000 employees, and we're growing. And we have a very large IT landscape to protect. CHI is in somewhat of a unique situation because we moved from being a holding company about 4 or 5 years ago now and chose to transition to be an operating company. And in doing that, we are consolidating and centralizing our IT from regional hospital systems and that used to be run all independently to really more of a centralized and regional model. So we've been working on consolidating our IT systems and trying to get the economies of scale that many try to do by doing consolidation. And of course that leads to a lot of challenges and a lot of unknowns. So today I'm going to talk to you a little bit about the 3 challenges that Lumeta is helping us with. First, I'll share with you about the challenges in our core operations, talk to you a little bit about our challenges in mergers and acquisitions, and finally I'll talk to you about how we use this information to prioritize our risks and do budget planning. So on this first slide, I show a lot of what Lumeta does, and for any of you that have looked at Lumeta or using it yourselves, you probably know a lot of this, but it's how are we able to really get the true visibility of our network so that we can use our core controls and security the best way possible. The goal of our security team, as many security teams, is to protect the confidentiality, integrity, and availability of our systems. But in order to do that, we really need to know what to protect. And as Skip covered just a few minutes ago, the threat landscape, the IT landscape, is really changing in healthcare. And as I mentioned, our organization is really struggling with major growth and just being a very large organization, and then IT all coming together at the same time. We have a very big landscape to cover and to keep track of. So we also are challenged with our asset management and change management controls. It's such a large landscape to cover that we really struggle with. What are all the assets that we're trying to protect? How do those change, and when do those change? And with new introductions in the business, we don't want to stop what the business is trying to do. They're bringing phenomenal capabilities from an IT perspective into our organizations to really improve patient care and help our patients. But they're moving very fast, and they want to use these tools very quickly. So we need to be able to find those unknowns in our network and remediate the associated risks with what they're introducing very quickly so that those can really be a capability to help our patients and help how we deliver the benefits to our patients. So we really don't want to find these risks reactively. So oftentimes the way that, in the past we've found new assets on our environments or discovery of new egress points is through maybe an incident or an event of some sort or a problem, and we don't want to keep discovering those open items that way. So what we're using Lumeta to do is to really identify the gaps in our processes and building a baseline for asset management and change management, and really tracking very quickly how things change across our network so we can immediately fix those environments before the vulnerabilities are exploited, either on the assets or on the egress points. One example of this is that we used in our threat and vulnerability management with Heartbleed that came out recently. We used Lumeta to search our network for specific vulnerable configurations. Lumeta provided us with a search string. We were able to go and do that search, and we were able to identify the assets and quickly remediate those assets with making changes to protect us from Heartbleed. So another way that we use Lumeta is to baseline and monitor and improve our controls and our incident response. So really discovering, as I mentioned, our baseline for all of our assets, but also as that changes, being able to regularly update how we do our patch management, how we do our threat management, how we enter those new assets into our login monitoring programs, and be able to have all of the security controls we need to around those various products and IP addresses. The next challenge that we are faced with is, as I mentioned, we're rapidly growing. We're going through a lot of mergers and acquisitions. We do, I would say, between 5 and 6 a year of major hospital systems. So each one of those hospital systems have many different areas within them, whether they are they have long-term care associated with them, residential living facilities, community-based services, clinics, other physician practices. The landscape is just very big. And as we know, healthcare is going through this consolidation. And doing mergers and acquisitions at the rate of 5 to 10 a year is extremely difficult, especially to bring in all of those unknowns that we need to be able to protect. So we use Lumeta during our due diligence phase, where we go into the new entity sometimes prior to purchasing, or after, maybe even immediately thereafter, and we're able to. It's a very portable product. We can put it on a laptop, we can go out to the facility, and we can really understand what is our landscape, what are all of our IP ranges. We don't necessarily know how to scan the rest of the environment using tools like Qualys or Rapid7 without knowing what landscape and what IP addresses to put in those other tools. So we're able to go and really understand what is our landscape that we need to integrate. Post-acquisition, we also want to go in and rediscover, has that landscape changed? Oftentimes in a merger and acquisition, we have a great loss of resources, and there's a lot of knowledge capital that's associated with that. As those resources leave, we also lose the information of what they've been doing to support those environments for a number of years. I mean, we don't want to lose people, but just in changes that happen, it often works out that they decide that the organization is changing so much and maybe they move on. So we really struggle with understanding what is our asset landscape and what do we need to be able to protect and scan for. Also, it feeds our budgeting. So how do we need to plan for how much it's going to cost to take on that entity, and to be able to budget to protect that entity and really look at the assets and determine, again, what is our asset landscape? Most of these entities don't have an asset management database, so we've got to go figure out what is the landscape and be able to protect it. And then we have this, then we feed the M&As back into the continuous process that we do in our core operations of regular monitoring, rediscovering, and understanding what's changing as the IT landscape is changing in the organization. The other challenge that I think many of us are up against is obviously budgeting and risk prioritization. So really, once we're able to identify what are all of those assets out there, what are all of our egress points, how do we better protect the organization, we can also better risk rank. Once we understand the full landscape, we can prioritize our risk remediation needs and what funding might be associated with that. If we really don't have a good idea of our full landscape, then it's very difficult to go back in and say where we want to spend money and what is the most risky areas that we have as an organization. So we really use this to identify those areas to invest in and to use the data to back and support those decisions that we're making. So we have many challenges as an organization to protect the confidentiality, integrity, and availability of our healthcare systems in this rapidly changing healthcare IT environment. And our goal is really to change and implement processes throughout the organization based on the data that we find, so that we can protect the organization and our patients while still enabling the new technology capabilities that are coming out in the marketplace. And that's all I have.